I'm going to have to read this because I haven't got it off by heart. So if you'll excuse me, I'm not sitting here grumbling at you or anything like that. You've all got a marvellous job to do. I do appreciate all the work that you do for everything, in all walks. But this is just something that, when I realised that Michael wasn't just getting old and decrepit like me, he was ill. And I thought, well, it might be a good idea to make a diary, but write it down, because I'm not going to be able to remember. So that's what I did. I would like to start by reading a typical episode from the diary I started as soon as we realised that he was ill and not just getting old, as my memory is not as it should be. We had been together for 59 years when Michael died in hospital on St. Valentine's Day last year, 2014. Diary the 12th of October, 2012. Michael said he had a sore throat and a cough and feeling rather low, so he stayed in bed until well after lunchtime, not wanting to eat. He gets up at 4 p.m. and sits in his chair, watching TV with a cup of tea. Still couldn't get him to eat. At 10 p.m. he said he needed the loo, but he couldn't get out of his chair. Went to give him a hand, and he was a dead weight. Got him almost to his feet. But his legs were shaking badly and I just couldn't hold him, so I had to let him slide back onto the leather chair, have a rest and try again. To cut a long story short, after 5 attempts, I had to give in to the fact that I wasn't strong enough to get him up, his balance right, or to enable him to walk. By this time it was well past midnight. I couldn't wake my daughter in Peebles. She has to be up at 5 a.m. every morning, so I phoned NHS 24. Explained what the matter was, and they said they would put me in touch with a nurse in Melrose who would phone me. An hour later she phoned and I repeated the situation. She told me that it would take her an hour to get to me. I had to get Michael comfortable on the floor. He was so restless that he kept slipping off the leather chair, so I gently slid him onto the floor, putting a pillow under his head and covering him with a blanket. But even so, I had to keep covering him up. He was so restless he couldn't keep his legs still, and his arms were flailing. He would hold his ears as if they were hurting, showing all the signs of anxiety, but when I asked him if he was in pain, he said no. Nurse arrives an hour later and her driver stays out in the car. She checked Michael over, then got the man from the car to help her put him onto the settee. She then went back to the car to talk to a doctor. When she came back, she suggested that Michael went into hospital. I agreed, because I'm the only person here to help him, and if he fell, then we'd be back to square one. All this time, by the way, Michael had his eyes shut, no indication that he understood a word. Nurse told Michael that he had a chest infection, but what she wrote on the note she gave me for the ambulance men was bilateral pneumonia. Why couldn't she say that to us? We're not stupid. Nurse said that she didn't know how long the ambulance would be as they are rather busy, so I sat on the settee next to Michael, trying to stop him from sliding off. Couldn't stop myself from dozing on and off though, but at least the men came at 4 a.m. I did not go with him as I was exhausted, and I hoped that Michael was not aware. The ambulance men said that I was to get to bed, and I'm afraid that is what I did. Phoned the hospital in the morning and they told me the usual, had a comfortable night, but I was to phone later after the doctors had seen him, and when I did, they told me I could come and collect him to go home. I was flabbergasted. Diary from the 21st of January 2014 at home. This is the day that completely finished me. I have been looking after Michael for many months now, as he cannot be left alone because he is incapable of doing most things for himself. We have carers coming in to help in the morning and again at night, and on the 19th of January we found a rash in his groin as he was going to bed. The next day it was far worse, and the carer said it was shingles, and as we were putting him to bed he was so sore I decided I had to get the doctor to him the next morning. An hour later he had wet the bed, and when I tried to roll him over to put clean sheets on, he was so stiff and unresponsive, eyes tight shut and not a word. I had to get assistance, so I phoned NHS 24 once again, and they sent a couple of carers along about 2 a.m. Yes, they put clean clothes on him, clean sheets, but no sign of washing him. And they left with the words that I should go to bed as I was exhausted. How the devil could I do that? The usual carer came at 8 a.m. at the same time as my daughter arrived with a dog to leave with me as she went to work. It was a good job too, as Michael was wet through again, so Kim helped the carer to see to him as I was dealing with the wet bedclothes. I felt so tired and useless, and then the social worker arrived and had me in the kitchen answering questions when the doctor arrived and went in to see Michael and Kim. She mentioned hospital because it was obvious that I was at the end of my tether, and the doctor told her that she should be aware that should Michael go into hospital, it was quite likely he would not be home again. By the way, the shingles were all over his penis, scrotum, inner thighs. He must have been in agony, as they were fiery blisters and he was incontinent. I phoned the doctor later and asked him to arrange for Michael to go into hospital. I had to take that risk. No way could I manage now, even with carers twice a day. So in the afternoon, the ambulance arrived to take Michael and I into BGH, where we were put into a cubicle to await a bed in a ward. They did not treat him as an old man in pain, in need of help. He was obviously just a body that needed a bed. They dashed in to take his blood, check his heart, and then left him with a thin sheet over him and no pillow. I found myself a chair and sat with him, but he was completely unresponsive. In the end, he fell asleep, and a good thing too. I kept an eye on the time and realised that I would have to go for a bus to get home, but there was nobody about to ask. Felt very guilty to leave him. As soon as I got home, I phoned the hospital to see if they had got him into a ward and that he was being seen to, and they told me to phone it in the morning. I was given strict instructions not to go in the next day. I was to rest and my daughter would be in to see him. I visited him the following day and he spoke to me twice, and that was in a whisper. I don't know, and I love you. As the days wore on, we found him getting worse. We had to tell the nurses that he couldn't see his food and that he would need help to eat. We also had to tell him that the tablets he should have been taking were in his wash bag, soluble ones. We found that the tablets that they were trying to get him to take were in a pot on the windowsill. We also had to tell them that Michael had thrush in his mouth. When we went in the next day, they still hadn't given him any medication for it. We tried to help by giving him pieces of orange and sips of juice, but it was obvious that he was in need of rehydration. But when I mentioned this to one male nurse, he just gave me a filthy look as if I didn't know what I was talking about. As the days wore on, we saw him deteriorating fast. We felt that the sooner they moved him to the dementia ward, the better. Michael's CD player was mislaid and that did not go to Courtshields with him. Well, which is not the end of the world, but it was his one link to home and gave him a certain peace amongst the noise and bustle of a busy hospital. I phoned the medical ward one morning to see how he was doing and got the standard answer. He had a comfortable night and is quite settled. And when I asked if they had given him the medication for his mouth thrush, there was a pause. The nurse said she had to go and ask the nurse who was in charge of him yesterday. She was gone for at least 5 minutes and came back to say she couldn't find the nurse. Well, after 10 days, they moved him to Courtshields when they felt that the shingles were no longer infectious. At last, the staff there were treating him as a human being. On Monday the 3rd of February, I was phoned to say that Michael was being moved back to the ward to be rehydrated for 24 hours. I know I'm an old woman of 81 and haven't worked in a hospital for 40 years, but couldn't help remembering that in those days the nurse in charge of one patient would write up his notes at the end of the day so that the nurse on the next shift could be kept up to speed. I am not one to make waves, much rather take a back seat, but not when I see Michael treated in this way. We have looked after each other for 59 years, and it is heartbreaking to see this kind of treatment in this day and age. Carers. I would like to make a note about getting patients ready in time in the mornings to go to the day centre. They are picked up by transport even after several phone calls to remind the person in charge that it is the same time, same day each week. But please realise that it is not the fault of the carer. They were so good to Michael, but there are so few of them that quite often they only had 10 minutes per person. The timing got so bad that it turned out to be an added stress on an already very difficult time. Procedures. My daughter and I took it in turn to visit Michael as I was rather worn out, and this particular day it was Kim's turn to visit. And when she got there, they had just got back from taking Michael downstairs for a procedure. And apparently he was so frightened to go into the unknown that he refused to let them do anything. Kim suggested they take him down again. She would go with them to explain to Michael what was happening and why. So off they went. In the lift, Kim asked what would have happened if she hadn't come in. And they said they would have given him an injection to calm him down. And Kim asked why it was necessary when it was obvious that he was dehydrated, kidneys were not working properly. The worst thing you can do to a dementia sufferer is to take them out of their comfort zone. It really does freak them out. They took him into the room, and immediately the nurses said, "Oh no, not him again." But Kim explained to Michael what they were going to do. Put some gel onto his body and it will feel a bit cold, but not to worry about it, it will soon be over. Now he was lying there with his eyes shut. He wasn't listening to anyone, completely shut down. Kim had to put her hands either side of his face to get his attention, then tell him what they were going to do. It was a slow process, but at last he understood, and they proceeded. When they came back to the ward, Kim found a doctor to speak to and asked that they do no more procedures. He has had enough. He doesn't want to be there. Please let him just pass away in his own time. Make him as comfortable as they can, and as soon as they moved him to Cold Shields, this is what they did. I'm so grateful to my daughter Kim for having the empathy and patience to deal with these things. Thank you, Kim. If I could recommend 4 things that would have made an improvement to my husband's care, it would be these. 1. A dedicated specialist nurse to look after the care and welfare of these patients with additional needs, or at least to ensure that they eat and drink and take appropriate medication. 2. Someone to talk to family when they came to visit, to ask or answer questions about the patient, and to involve them in writing or explain the care plan. 3. Training for all staff so that they are aware of the difficulties faced by these patients, recognise the symptoms and understand their needs. 4. These are people who are suffering from a condition which makes any change terrifying. They need reassurance and to be treated with respect, the way you would want your parents to be treated.